Well, I am Dr. Nicoe Washington. I am a psychiatrist. I'm physically located in Oklahoma. However, I am licensed in 11 states as of today. I started this practice in 2017, so pre-pandemic. I was working on my master's in public health. I'd gone back to school, which felt very odd, to get my MPH. And while doing the MPH for a project, I ended up doing a lot of research on physician mental health, physician suicides. And that's kind of how my practice was born, out of me thinking, well, somebody's got to do this work, right? Because I didn't know that if there were a lot of people doing this work. We just weren't talking about it a whole lot back in 2017. So I pivoted from taking care of severely mentally ill people in crisis situations and in assertive community treatment teams doing home visits to a practice of physicians. So I started pre-pandemic, which was very interesting to watch that progress and to see the types of issues we were dealing with pre-pandemic versus the last few years. Physician mental health was born essentially out of that practice. I bought that URL, physician mental health, back when I started my practice in 2017. So I bought it and I thought, oh, I'll probably do something with this one day. So it sat in my dashboard for years, untouched, never thought about it again. As the pandemic was unfolding, I'm in Facebook groups with doctors, and people are asking, like, hey, I need to see somebody. I'm really struggling. Does anyone know anybody practicing in, Texas or practicing in Tennessee or practicing in Florida? And then you have 50,000 people come into the polls like, oh, try this person or try that person. And I thought, surely we have to have a better way of doing this. We need a central space for us to be able to go and to find a psychiatrist who is willing to see another physician. So that's kind of how it was born. It was in a random hotel room. I was on a locums assignment March 2020 when the world was falling apart. And it was in this hotel room that I was like, okay, it's time to pull the trigger. So physician mental health was activated. To date, we have psychiatrists in almost all of the states. There are some states that we are lacking. I am working on licenses in some of those states and working on recruiting people from some of those states, but that is essentially how it was born. So we have psychiatrists who have said, yes, put me down. I want to be a resource for my peers. And that's what we have there.
So the website is physicianmentalhealth.com, and the
Yes.
idea is that this is a site for physicians to find psychiatrists that are comfortable with and willing to treat physicians specifically.
Yes.
Tell our audience a little bit about why a doctor might consider reaching out to a psychiatrist specifically as compared to a psychologist or even a physician coach.
Yeah. I think psychologists are great if you feel that your situation can be benefited by therapy and you don't necessarily feel like medication is what you need or where you need to go. That's fine. I think get to somebody. Are there psychiatrists who do therapy? Yes, there are. Unfortunately, with the demands of insurance companies and time, sometimes the psychiatrists are not doing therapy, but psychiatrists have the ability to do therapy. And on our site, we do have a designation of, if this person does meds only or if they do therapy also. So that can give you a bit of an idea. But there's nothing wrong with going to a licensed therapist to receive therapy if that's what you feel like you need. Sometimes you'll see a therapist and then they'll say, you may want to consider medication, and they may direct you to a psychiatrist. But there's nothing wrong with you saying, well, I want to try therapy first. I don't know that I want to do meds right away. For coaching is a little bit different. I mean, I think it depends on what you are looking for. One of the things I see is that people go to coaches when they really have mental health issues, because it's easier to say, well, I want to go to a coach because I'm having issues with motivation and getting things done and being assertive, and whatever the reason is that you would seek a coach for. And that's fine. Some coaches are great and they can help you through these kinds of little holes that we get into. But if you have depression or you have significant anxiety, you may need medication. I mean, sometimes medication is going to improve the capacity for what you can get done in therapy and coaching. So, there's room for it all. I think we just have to figure out what exactly is the root problem and then go from there. Medication isn't needed for everybody. Some people can really benefit from therapy, especially if they have a milder, maybe mild to moderate depression, anxiety. Medication may not be necessary. But if we're moving moderate to severe, then we may want to talk about what your medication options are. If your sleep is impaired, if your sleep is impaired and you haven't been able to get it into a good schedule, even with the tips that you get behaviorally from your therapist, we may need to talk about medication. If your functioning is impaired, if you are forgetting things for patients, if you are the person who used to be able to remember the last 5 patients you saw and then go get their notes done, but now you have to write everything down, or you forget things, or you find that patients are calling back and saying, Dr. So and so was supposed to put an order in for this, but I don't see it. And you're making mistakes like that. I think we should at least have a conversation about, what's going on, because I think functional impairment, so sleep is one functional impairment. And then if you're really, really angry, if the anger is interfering with your relationships, if you're starting to bite or be biting with patients or staff, that might be a good reason to at least talk about, if medication's an option. And of course, if you're experiencing hopelessness, suicidal thoughts, you are having the thought, people would be better off if I wasn't here, even if it's not active suicidal thoughts. So if you're even having those thoughts of people would, my family would be better off if I were gone, or I wouldn't kill myself, but I wouldn't be upset if I had a car accident and just didn't make it, or if I didn't wake up in the morning. All of those kinds of things might be reasons to see a psychiatrist and have a medication discussion.
As you're saying all of these things, I'm thinking, what would I say to my patient if they told me any of these symptoms? And of course, I would be urging them, encouraging them to make sure that we get the proper diagnosis, that we consider medications. And yet, as physicians, it's hard for us to apply that to ourselves. And part of the reason is concern about potential stigma, especially when you are starting to move into that impairment stage. So, what advice do you have for physicians who are worried about that?
The first thing I would say to you is we are horrible at recognizing these things in ourselves. I've seen enough physicians over the years to know that we are horrible at recognizing how impaired we are. We do work at a really high level. We are used to functioning at a high level. We're used to running on fumes. I think a lot of times we're not doing great and we don't even know it because we just keep pushing through because that's the culture of medicine. But we're horrible at knowing. So if other people are telling you, I think something's wrong, or you start to notice that functionally things aren't great, I would say go for it. I mean, we just aren't the best when it comes to us, because we think that, well, that won't happen to me. Like I'm good. I even take care of quite a few psychiatrists who have said, it took me a while to realize that I was depressed, or I was having, anxiety to the point that needed medication. And we're in this every day. So I think it is not uncommon. Another thing, you think you're the only one, you think all your peers have it together, unless things are really bad, or a person is just brutally honest, most of us are not talking about how we're really doing. You say, hey, how you doing? And we all say, oh, I'm fine. I'm okay. Oh, living the dream. We say those kinds of things, but we never really say like, well, I'm really burned out. I got yelled at by 4 patients yesterday and it just took a toll on me and I couldn't sleep last night. We don't say those things. So I just would encourage you to go for it, because I think we all have worked so hard to get where we are, that I would hate to see something like some anxiety, depression, something that can be addressed and treated, take this from us, because we've all worked so hard to get here.
What tips do you have for doctors to kind of prevent getting into any kind of trouble with licensure or other professional repercussions?
I think you be honest. Honesty I think is important. I will have doctors reach out to me and we'll talk, and they'll say, well, is this private, or can you not create a record, or can you, can this be kept from the board? So the first thing is, I don't report anything to the board. Boards don't just come to me and say, hey, are you seeing, and give me a list of doctors that they have licensed, right? You would have to have shared with them that you were seeing someone. So a lot of people will say, well, I just won't tell them. Like, I just will lie. And that's one approach, not the one I recommend, but that is one approach. And the reason I don't recommend it is because what if your depression or anxiety get to the point where they are impairing and you do have something reported, to the board about you, and then you have to come back and say, well, I was dealing with depression at the time and my depression had gotten worse. And then you have to explain, well, why didn't you disclose that, initially. So I just think it is in your best interest to just be upfront. I have yet to have a person not get licensed in a new state because they admitted to being treated. I have yet to have a board revoke somebody's license because of depression or anxiety. I write lots of letters to boards. I've spoken to lots of board representatives. One thing that people don't know, most every board has some sort of wellness program that you can link into, and once you're in that program, that can help you. If something was to happen and you were to have some sort of problem related to patient care as a result of some kind of mental illness, that is in place for a lot of states, and not a lot of those programs are used. A lot of states are actually looking to change the way they ask the questions. So they're not, a lot of them are moving away from asking you, have you ever been treated for any kind of mental health conditions in your life? They don't need to know that at 15 your parents went through a divorce and you had therapy. They don't need to know that. They don't need to know that you lost a parent in your early 20s and you went to therapy because you were depressed. That's irrelevant to today and your practice of medicine. So I think a lot of states are getting on board with the questions, which is really nice to see, but we still have a ways to go.
So what you're saying is, and you've worked with a lot of doctors and you've actually worked with a lot of different medical boards in different states. And what you're saying is, even though some doctors may have had some serious impairment and worked through some of their issues, that they've been able to deal with that through the board and they've been able to continue to practice medicine.
Yes. Yes. And most of the board representatives that I've spoken to, I mean, it's very obvious that they're not trying to take anybody's license away. There's not enough of us. They want us healthy. They want us taking care of patients. They don't want to lose us. One, honestly, it looks bad to them, right? It looks bad if they're losing doctors and not supporting physicians who are struggling with any kind of mental health stuff. It just doesn't look good. The optics aren't good in today's world. It just doesn't look good. One, but they genuinely want to keep you working and in the workforce and taking care of patients and all of those things. So I have yet to have a situation where we were not able to work this out. Sometimes does that require a leave of absence? Yes, sometimes it does, which is tough for a lot of people to deal with. But I've yet to have someone lose a license and not be able to return to clinical practice.
That's really reassuring. And I think the message here is that physicians shouldn't delay getting the proper help because of these fears and anxieties, because ultimately delaying that is more likely to cause them to get into trouble with their practice. And of course, potentially even lose their own life if they become, severely depressed.
Yeah, absolutely. Absolutely.
Or hurt a patient because they're not able to properly care for them, which is also would be a tragedy. And
Right.
that's the main thing that the boards are trying to prevent, is to protect patients, and which is what we
Mhm.
all want to do as well.
Because the board's job is to protect the public, right? To make sure that the public is safe and that they have safe physicians out there practicing. They do represent us, but there are people on the board that they have to think of it from that lens of, I have to make sure that I'm putting out physicians who are safe and who are going to be able to take care of people appropriately. And that's one piece I think that sometimes we don't think about. Like we think, oh, well, it's just affecting my family life or my home life. It doesn't affect me at work. And that just can't be possible. It can't be possible that you can't remember stuff and it not affect your job. It can't be possible that your fuse is short because you're irritable and it not affect. You may not, go off on a patient or be rude to a patient, but you're not going to be all in. When that patient comes in and they say, oh, I used to take this one green antidepressant, or I take Zoloft and it's green, and you in a good state, you're probably going to look up the pictures. You're going to be like, oh, was it this one? And you'll go, oh, it was 50. Like you'll go that extra step, right? When that person says, well, I was taking this one medicine, but I don't remember the name of it, you'll go the extra step. When you're not well, when your anxiety is high, when you're depressed, you just will say, well, okay, well, I guess you just need to figure it out. You just won't take that extra step. You won't make that extra move. You won't look up that one extra thing to help that person out because you just don't have the energy and the capacity and motivation to do so. So it does affect your relationship with your patients. It affects your communication with them. It affects how thorough you are with explaining things to them, how patient you are with them. All of those things affect it.
Absolutely. So the idea, of course, is to hopefully get physicians engaged in the right kind of treatment before they get into any type of impairment.
Yeah.
So what does a typical relationship, therapeutic relationship with a psychiatrist look like for the average physician in your experience? And talk to us a little bit about cost
Mhm.
and some different ways that doctors can mitigate those concerns.
Yeah. It looks the same as anybody else who sees a psychiatrist, or at least it should, right? It should look the same. When I go to doctors, I'm just not equipped to be objective about myself or my kiddos, right? So when when I go to the doctor for me, when I take my kids to the doctor, I want them to treat me just like they would anybody else. Forget that I have a little bit of knowledge in this area because it's little, right? So when physicians come to me, I talk to them just like they're anybody else. I explain things. I may say, okay, I may not have to explain this to you, but I'm going to anyway. Like, let's talk through this like you don't know anything. And that way we can cover all our bases because I don't know how much somebody knows and I don't want to put them on the spot. And, well, what do you know about that? I treat them like I treat everybody else. So visits would be typically monthly in the beginning. Once I have a doctor who's stable and doing well, then we spread those visits out. So we're talking every 3 months because I know we're all busy. Our schedules are tight and trying to see somebody monthly. So we would spread you out like every 3 months. In some cases, every 6 months, depending on diagnosis, how the person's doing, what special circumstances. We will do every 6 months once they're really stable. And so it looks just like that. A lot of psychiatrists, though, I will say, a lot of psychiatrists are cash based practices. Um, Mental health reimbursement has been terrible for decades, and a lot of psychiatrists have just said, I can have better relationships with my patients and more time if I just take cash and just see them and they pay out of pocket. Cost is going to vary. Cost is going to vary if you are working with an accountant and you have a practice that pays you and you have a unique financial structure. You may talk to them about if that treatment can be included in your compensation package, and if that's something that can be written off. Probably would depend on how you're structured. Like, are you a private practice paying yourself? Are you employed by somebody else? Do you have an LLC that you work out of? Those are all accounting questions, but ones I would definitely be asking if I were you.
I think you have to look at your health as an investment in yourself, and it's
Mhm.
probably not the place to try to cut corners or cut to the bare bone. And I'm always shocked at what we will spend money on and what we
Yeah.
won't. And I think when it comes to high quality medical care, it's worth it. And it's not, in my opinion, that expensive because I see some of these coaching services and the charges that I'm seeing are astronomical. Like they're charging $500 for a 45-minute phone call. Now,
Yeah.
psychiatrist fees are typically what, like $200, $300?
I would bet for a new evaluation, and it's also going to be dependent upon where you live and in the area. Because if you, I would say probably anywhere from 300 to maybe 450, 500 for an evaluation visit. After that, for your follow-up visits, you would be looking at, I don't know, 150 to 250 range. But like I said, if we can get you feeling better and we can spread those out, that would be less of a financial burden on you. And you're right about cost. I We're a very insurance driven society. So when people say, well, I have insurance, like I pay insurance every month, why should I have to pay out of pocket? And I will often come back to them with, well, you have car insurance, right? We all have car insurance. And how many times does something happen with your car and you choose not to even go through your insurance because you say, well, my deductible's high, I can probably get this fixed for this amount. I can probably, forego having to go through the insurance. And they save, they use it when something big happens, like a big accident, but not little dings and dents along the way. Kind of very similar thing. Our health insurance really, I look at it as it's there in case something really big goes down. If I have a big hospitalization or a surgery or something really, I get diagnosed with some big illness or some big disorder. But for little stuff, dermatology, a lot of those are cash practice. I just pay out of pocket because it's worth it to me. And usually I can forego a meal out here or there, or the impulse purchase. I can usually forego some of those things to be able to afford that dermatology appointment. So I usually do encourage people to look at it in that way.
It's all about choices. Now, I see that I think you offer telemedicine visits or
Mm-hmm.
web visits. Do you find that most of the psychiatrists in your group do that?
Yeah. So when we first started the website, we were asking exclusively about tele because it was March 2020, so everybody was transitioning to tele. Some people on the listing are still tele, like that's where they are. Some people have in-person options if you're in that state, but I do find most of the doctors don't want to come in. Like they just don't want to come in. They prefer to be able to close their office door, visit with you for 30 minutes for a follow-up, and then be able to get back to work. That's a lot less disruptive than trying to, drive across town. I gotta stop here. I got to drive across town. I got to wait for the appointment. I got to drive back. And so it's just so much less disruption to the system. And most of us are very busy and don't have a lot of time anyway. So I do end up seeing a lot of people in their offices, in their cars. Before surgery in the morning, in the car in the parking garage, at their schedule. So we've most of the people are doing tele, and really most people are still offering tele services, even now that we're 3 years removed from March 2020.
So is your practice now mostly physicians?
Mostly attorneys, C-suite executives, media people who just don't want to be seen in the psychiatrist office. I mean, talk about stigma. I mean, it's great to say that, oh, there shouldn't be stigma associated with mental health treatment. This should be fine. But I think the reality is, if I'm a mom and I'm at a psychiatrist office and I look over and I see my kid's pediatrician in the psychiatrist office, I may pause a little bit, right? That mom may say, "What's Doctor So and So doing here?" And, it just the stigma is there. So if you're recognizable in the community, my attorneys, my C-suite people who run companies don't want to run into their employees. Media folks don't want to run into people who are like, "Hey, you're that lady from the news," or "You're that lady from TV." A lot of people who want kind of, they just want a private space.
Is there anything unique to physicians or to that group that you see, or what are the most common diagnoses? I'm guessing depression, anxiety. Do you see a lot of
Yeah.
ADD? What other things do you see?
Depression and anxiety are very common. I do have several physicians with ADHD. Most of them diagnosed, well before they get to me. It's just a matter of being able to find a place where they can continue treatment. A few new diagnoses, I will say, when I get a physician who comes to me and says, a new physician especially, who says I can't keep up with my charting. I a lot of times that may end up being, an ADHD thing. And I don't mean like being a little bit behind. I get people coming to me who say, like, I have 200 and something charts open that I haven't finished. I can't get them done. That's going to look like maybe some ADHD, but maybe it's anxiety, right? Maybe they're going over the note to make it perfect so many times they can't get them done. So we have to tease some of those things out. But those are probably the top three. I do have, a few physicians who have bipolar illness who we manage it very well. We do what we need to do, but as you would imagine, that would be a very tricky diagnosis to manage in a physician who may have lots of loss of sleep and all the things that are in direct opposition to what we tell people with bipolar disorder to do. So we work really hard to keep things stable and keep things going.
Well, I'm so appreciative for what you are doing. Is there anything else that you would like to share about what physicians should know or about your resource?
I would just say access it, take a look at it. If you think that you need to see someone, don't hesitate to look and see who's in your area. Because we're doing tele, it may not be somebody who's in your city necessarily, which is great because most of us don't want to see people that we may run into at medical society meetings or in restaurants or different activities around town. But maybe somebody who's in the same state a couple hours away. That's the benefit of telemedicine. It really allows you to continue to get that treatment, even if it's not, in your area and you don't have to drive 2 hours to go do it. Before this, and before tele was popular, I've had people drive 3 and 4 hours from Texas or Arkansas to see me here because they didn't want to be seen in their town or their city. So I think this just opens up just a lot more flexibility, and I encourage you to take advantage of it.
It really does. Thank you so much, Dr. Nicoe Washington, the founder of physicianmentalhealth.com.